Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Michael Mainiero. He's Senior Vice President and Chief Digital Information Officer at Catholic Health. Welcome, Michael.
Thanks for having me, John.
Yeah, excited to have you on. Lots to talk about. Seems like you guys have been doing some really good work with Epic, and a topic that I think everyone in our community loves to talk about since it's such a big part of their day. But before we go there, tell us a little bit about yourself and Catholic Health.
Sure. All right. Catholic Health is a Long Island-based health system. We've got a mission-driven approach, delivering compassionate, high-quality care. We've got 6 hospitals out here in Long Island with 17,000 employees, and we're deeply rooted in our communities. My role is everything technology, digital data, essentially the entire continuum of IT, patient access to operational excellence. And really, my job is to make sure that digital tools don't just exist, but they create real value for patients, providers, and our organization.
Yeah, that's awesome. I didn't realize Long Island was that big, but maybe I need to get out there more.
It's very big. Yeah, it's very long. It's
Yeah, that's
beautiful this time of year.
Yeah, I thought about flying in there once and realized, wait, that's a lot further away than I thought. Awesome area though. Well, you're doing some exciting work. You were recently recognized by Epic's Honor Roll Good Maintenance Grant Program. Tell us, what does that mean to you and your team to be recognized by Epic that way?
So I think it was a proud moment, certainly for the teams. There's a lot of work that goes into this, and to get recognition is great. But I think it's not just about the badge, getting that badge, if you will, but what it represents. And I think it's about proving you're using the platform to its potential. And the way Epic has it set up, it's about proving that out so you improve care, operations, whatever it may be, access. And we'll talk about some of that. But we're only one of few handful of systems that got it so far in 2025. And we've actually got the lowest tier. There's 2 more tiers that we can go to, which with more rebate, if you will. But we see this as foundational. It's table stakes. The cum laude is what we got. And this one was about strong infrastructure. We did DR recovery, platform governance, and really we also did some work in the provider portals to make it easier for them. And these, to me, are table stakes that any CIO should be doing. But what's great is Epic says, hey, recognizes that, gives you money back, and we can reinvest that into Epic.
Yeah, I think it's pretty cool. I actually think this is born out of Judy saying, we've built all this stuff. Why aren't people using it? And she wants to motivate that usage, right?
It's so interesting. And I remember reading that article. It's kind of like a risk sharing you do with some vendors. But what's interesting about this is, it's not just about IT just turning things on or checking boxes. You have to, the business has to be behind it, right, as well. So when the C-suite sees money involved, rebate, they get excited. So from a transition management perspective, I'm going to have a little more leverage in getting it done, right? So it's kind of creating a perfect storm to, not only get money back, but move things forward and have real outcomes.
Yeah. It's true. The CFO getting a rebate from a vendor, that doesn't happen that much.
Totally.
They love that. Well, let's talk about some more of, tell us more about the achievements you did as part of the program, and what can other CIOs kind of learn from your experience executing some of these programs?
Yeah, I think a couple of things. I think what we've done here, and I know some other CIOs have done this as well, is we created an Epic transformation department within the office of the CIO, and essentially, what that is making sure that all things, whether that be our upgrades, our where are we with our modules. Epic has something called a Gold Star program, which is the adoption of their features, but based on complexity and value, and it's sort of a roadmap. So really. The framework for this was interesting because what we wanted to do is make sure whatever we picked attributed to our goals, right? What the goals that we have as an organization, and then it becomes win, 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 right? You're taking advantage of the platform that you bought, right? Because I think what a lot of CIOs know and the business doesn't normally know is it's not just turning on Epic, right? There's a lot of work once you've got it getting on. It's really like a city that needs to be continuously maintained and developed. And we focused on population health, really improving our HIE. And those two things right there, we in Long Island are very interested in population health, but also having richer longitudinal records on patients is going to serve for better outcomes and whether it be clinical decisions, whatever it may be, that helps everybody. We also leveled up our enterprise data analytics with their platform. And a lot of this is, I think, as I said earlier, is table stakes, making sure that our DR, so we can cut over to other data centers. We've also got Epic in the cloud, so we can cut over to that as well. So that's important. And then making sure you're staying current. So that was part of what I would call table stakes. And then I mentioned outcomes. So we see 70% of our medication refills now flow through, Epic workflows. We've got social determinants of health fully embedded in the clinical record, and we've completely expanded interoperability. So basically, data exchange across different partners in the HIE. So those are some, and again, these are table stakes. There's a lot of things we want to do with this, but those were our achievements this year.
Yeah. I mean, I find it really interesting. There's a friend of mine, a CMIO, that, and it was shortly after go live, he said to me, John, I have 5,000 tickets related to Epic. He's like, and some of them are couple hour fixes and some of them are 6-month projects. And he's like, how do I prioritize the
Yeah.
5,000 opportunities to make the life better for my users? Right. And I mean, it sounds like, I don't know, I'd love to hear your thoughts. Like, this almost prioritized some of that. Again, you were lining them to your strategic goals, which I liked as well. But did you face that kind of same
Yeah,
opportunity, if you
absolutely.
will?
Absolutely. So, the way I kind of talk about it with my teams is like it's never ending. So that's good news, right? So you'll always have a job, but it's never ending. And I think to that gentleman's point, you know, prioritization is important. But the challenge is, I think from a business perspective, you need to understand we actually use what's called rice scoring. So we want to understand, um, the reach, the impact, the confidence, whether we can do it or not, and the level of effort. So with that, it sounds like a lot, but a lot of people do this in their head. A lot of times, to those tickets, some take 2 hours, some take 2 months. That's your level of effort, right? If you're not confident in it and you can't really clearly articulate the impact or outcomes as it pertains to your strategic business, it's going to fall off the list. So I think if you get it all together and crowdsource the prioritization, you really have determinants of what to go to next. Typically, I want to do the smaller, higher value things first, right? So you're continuously making improvements. But some of those bigger tickets that maybe take 6 months, if it doesn't pass muster with the business and we don't have partnerships, okay, we're not doing that. So for example, we were only level one. To go the next level with Epics, I think the next level would be Magna and then Summa. We then have to do a lot in the nursing and clinician arena, but that's going to require adoption, acceptance, and partnership with them. So in our confidence, in our rice scoring, that would be low until we had real champions to work with us. So I think if you use that framework, it's a way of really figuring out what to work on next.
Yeah, that's really good insights. So what are you planning to do with the grant money from Epic? What other projects are you working on? How are you going to leverage the resources?
Well, I mean, to be cliche, I think we're interested in AI wherever we can do it. So I think there's a lot we're doing with Epic already, but we decided to reinvest in as much AI with them as possible. So Epic Ambient, partnering with Ambient, Epic doesn't provide all of the ambient, but we want to be able to automate visit documentation. We're also doing a lot of predictive models with them and, paying for the package, if you will, with their AI platform. So predictive insights for things like readmissions, sepsis. We're doing we're using GPT for physician notes and messaging back to patients. So that's pretty cool. and also filtering in baskets so that we can make it so that physicians don't have to spend so much time. Like, you don't need to read a thank you. You don't need to read a prescription refill that you already have 4 refills on, right? These are things, and the outcomes are great. So physician burden, time, and we're measuring all of this, right? The less time they have to spend in Epic, the better, right? And really, Epic has this platform called Slicer Dicer, which is like their data model. You can go in and actually do on the fly data, but they actually are doing AI in that now. So using their sidekick, it's what I guess what they're calling it. So you can just have conversations with Epic data. So this is going to be huge for population
Yeah.
health and operations. That's just where we're reinvesting this first tranche.
Yeah. That's really cool. You know, it's interesting you kind of mentioned this on the AI medical scribe, ambient technology perspective, but, you know, as you approach innovation, how much are you choosing to leverage the EHR and the capabilities you just talked about versus kind of enabling innovation outside with outside vendors as
Yeah.
opposed to the EHR? How do you kind of approach that balance?
Well, I mean, Epic is our foundation. We have, I think last time I looked in our CMDB, we had over 800 systems. So, if the capability exists in Epic and it meets a need, we go there first. And even if the other product is a little bit of a better mousetrap, we'll reinvest in our core platform. Epic's scalable, secure, already embedded in the clinical workflows. And I think, when you look at third parties, they call them bolt-ons or whatever, we have plenty. But the reality is, it gets complicated, right? Because if you change clinical workflows or Epic upgrades, you've got a lot of upkeep. But Epic is our default. But that said, we're really not closed off to third-party innovation. We are very selective and we integrate with external vendors where there's a clear gap and a clear ROI. So it can't just be a gap. We have to be able to prove out value up front. And vendors are great. They come with their value from other clients, but that's other health systems. We need to understand the true projected value, and it has to pay for the total cost of ownership, setup, maintenance. So we have this discipline. Every tool has to fit our total experience strategy end to end. It has to improve care, support providers, and it can't fragment our digital ecosystem. And I think that's what probably any CIO listening to this, that's what they wake up in the middle of the night thinking about. You know, having a very fragmented ecosystem is very complicated to run and operate. So we have a governance model for this to sort of stop sprawl, but also make sure we're bringing things in a smart way. And some things Epic just, that's not what they're interested in. They don't provide the ambient service, they integrate with it, for example, or there's certain AI models that they're not doing, we'll go outside for that. So a healthy mix, I think, is the way, but the core is Epic.
Yeah. It's always amazing for me to hear you have 800 systems. You're not
Yeah,
alone, right, in this challenge. But it is that balance, right, between leveraging the core, but also solving the problems that your organization faces. So
totally.
it's interesting. If you look kind of outside the EHR, we talked a lot about Epic, which makes total sense. As I said, you live, eat, breathe, and sleep it, right? At least the doctors do, the users at your organization. But what do you see as some of the biggest challenges outside of the EHR, and how are you kind of working to address those?
That's a good question. So, outside of the EHR, it's interesting. I often think about this. Technology is the easy part in many ways. I mean, look, when you're creating something brand new and inventing something, that's very complicated. It's a bet. But a lot of the systems that we're using are tried and true, right? Epic, a lot of the modules. To me, it's not tech, it's actually execution and alignment. Those are the biggest challenges. And, you know, when you're dealing with the headwinds in healthcare today around financials, cyber's up 100, well, every time I look, it's up another 100%, right? Then you've got your denials from the payers, all of the things that are headwinds and trying to successfully, provide the best outcomes and care for your patients. What happens in a health system is you get a divergence, and naturally a divergence of prioritization, or you might have differentiation in people's understanding of clinical systems. We call that the TQ, or the technical quotient, right? You've got your
Oh,
EQ,
interesting.
your TQ. So we kind
Yeah.
of like subtly gauge that with folks and say, okay, maybe they need a little more care or time to understand it together. But really the challenge is creating that culture where people across the organization, whether it's clinical, ops, or digital, are rowing in the same direction. You know, we're not thinking seven different things, right? Or different goals. So we built an agile operating model, really with cross-functional collab with the business, sorry. So we've got accountability with the business up front to understand the value and hypothesis of what they want to do. And then my team is accountable for co-partnering with them to design and deliver. There's always whether you're setting up a portfolio for the quality team or for the population health team, there's a never-ending backlog of work, right? And every CIO across the country is dealing with this, right? And folks want more and more and more. And one team might not know that you're dealing with a whole other portfolio with the same players. So, how do you do that? And I think it comes down to communication, alignment, and then really making sure we only execute on what we have clear planning done on it. So I think people assume that a project's already started, right? When they have a conversation with you. Uh, and I think most CIOs are following ITIL or Agile or some intake process. So I think, John, if the question is what the biggest challenge is, it's making sure we can focus on the right things.
Yeah. No, you're right. It's where to focus on in the TQ. Wow, that is super interesting. As a tech guy by background, I often take for granted my technical understanding when talking to someone. Then I realize, oh, that's right. They don't have that technical understanding. So you
Yeah.
got to educate them, right? That's one of the biggest challenges.
And you know what? It's okay because I think this is also challenging for IT folks because I think sometimes they think they know all the things, right? Or
Yeah.
they did
Is
it
that
somewhere,
MQ
and
medical quotient?
yeah, myself included, right? So how do you create a balance where we're listening and
Mhm.
having empathy for the problem? And sometimes they might not be articulating the problem, but you get to the root of that, and oh boy, do things work well when that happens. When it's like kind of like the stars align moment, right? And then when you think about all the projects you've done in your career, the ones that went really well, you had really good alignment all along.
Yeah.
And you were able to pivot. If you don't, that's when the surprises happen, or they think it didn't go well, but you did. That's a very common experience.
Yeah. I mean, I remember many meetings with the health center director where it's like I had to describe the TQ so she could understand it, or vice versa. She was describing the medical side so that I could understand that, and like you said, finding the compromise of the two. Fascinating. Well, we always like to end these podcasts with a little bit of career discussion, career advice. So I'd love to hear what would you say is the best piece of advice that you've gotten in your career?
I think about where I am today and what helps me the most in moving forward. And I think just taking a mindset and this came to me in two ways. I think one is in the Agile Manifesto, valuing people and interactions over process, but really kind of parlays into someone that said, "Hey, Mike, it's not all about the tech. That's not what's
Mm,
going to change. The features aren't going to change healthcare. So you're not chasing capabilities or can we get that capability? It's the leadership and the sustainability of whether the system or the workflow that actually transforms healthcare.
mhm.
So, that's like saying, the kitchen is going to make the restaurant great, right? So, so,
You
so
and I
that's
in
how
the
I think
kitchen may
about it.
not be as good as a chef. Yeah.
Yeah, right. So you can get, or like, I've heard this in many different ways. The chefs have the same knives, the same setup. Why is this restaurant better? So that comes down to leadership. And I think that's really the advice I got. So when you take that advice, you start to have more empathy for the people you're working with. So spending time with the people that actually do the work, whether that's a nurse or a clinician, and listening to them, having empathy, but taking that and mapping it to what you're working on. And I think I also live by, you know, just because you're working hard with activity, that doesn't mean you have high impact. So at the end of the
Mhm.
day, you always have to reset. Where are our values? care safer, faster, more human. Everything else is noise, right? So if you can sort through that and align with people you're working with, the rest is just technology, and you depoliticize things and it's just about getting tech there. But I think people lead with, we're going to transform because we're going to get this software, we're going to get this thing in place. And a lot of good vendors know this too. They bring a team and they help strategize with you. But the reality is, I think once you make that distinction, I think things become a little better.
Yeah. Good advice. Man, I learned so much just sitting there in the nurses station. I think
Yeah.
sometimes they're like, what's John doing? Right. But observing them was so
Yeah.
valuable and opened eyes. And also just the availability for them to be like, oh, John, you're here. I need to tell you this. And you're like, oh, thanks.
Well, yeah, it's so funny, when we have our teams rounding as much, like I want them to round as much as possible. I'll walk around as well, but sometimes they don't want to do that because they don't want to hear it. They don't want to hear how bad something is. But
Mm,
what I say is, look, if a nurse is complaining about a phone or something like that, a
right.
typical IT person might say, well, they didn't have the battery charged. They're dealing with people dying. They're dealing with things that, are very stressful. If your technology is not working, you're not going to be happy with the IT team.
Yeah.
So for me, that's always a challenge, is refreshing hardware, making sure things work. And, having that empathy is important. You can't just look at the tickets. You have to walk
Yeah.
around. So John, I think to what you're doing is hanging out by the nursing station. Hopefully you brought donuts or something, but uh, that's the way to
There
find
usually
out.
was food, right? That's the way to people's
Food is always is the great equalizer, right?
It is. Michael, this was really educational, and congrats to you and your team and all the great work you're doing with Epic, and congrats on the grant program and being able to receive that recognition. And thanks for sharing all the insights and perspectives. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting application. Thanks, Michael.
Thanks, John. Thanks for having me.